Let's move on to the next topic, which is genodermatosis. It is genetic disorder with dermal manifestations. First type is neurofibromatosis type 1. It is autosomal dominant in nature. It is painless condition. It starts from adolescence. Here, lesions are skin colored papillonodules, and this clinical sign is known as buttonhole sign. Next type is plexiform neurofibromatosis. It is congenital and it is origin from multiple nerve vesicles. Its lesions are diffuse, enlarging mass, and on palpation it feels like bag of worms. Cafeolate macules. These are hyperpigmented macules of more than six in number, and in prepubertal it is more than 5 mm, and in postpubertal it is more than 15 mm. Axillary freckling. This and Lish iris nodules. It is pigmented iris hematomas. It is visualized on the slit lamp examination. Next type is tuberous sclerosis complex. It is again autosomal dominant in nature, and it includes Voigt's triad, which includes epilepsy, low IQ, and adenoma sebaceum. Its features include ash leaf macules, early skin lesion, which are hypopigmented macule on the trunk, adenoma sebaceum or facial angiofibromas. These are reddish-brown papules seen on the malar area and nose. Malar area and nose. Chagrin patch. These are leathery papules on the lumbosacral region. It is composed of collagen fibers, also called as collagenoma, and Conant's tumor, which is periungual fibromas. Next type of genodermatosis is Strauss-Weber syndrome. Sporadic inheritance, also known as encephalotrigeminal angiomatosis. Its features includes epilepsy, glaucoma, facial port wine stain, as you can see in the diagram. It is seen from birth and it is permanent in nature. Lesion is unilateral, is pink red presentation. As aging, it becomes purple. Treatment is pulse dye laser. Next topic is ichthyosis. It is disorder of keratinization and it includes fish-like scales with no inflammation. Congenital ichthyosis, it is also known as ichthyosis vulgaris. Vulgaris term means most common. It starts from 3 months to 12 months. It is autosomal dominant in nature and there is defect in the filaggrin. Fine white scales are seen. It is associated with keratosis pilaris, which is occlusion of follicles, and hyperlinear palms. Next type is X-linked ichthyosis, also known as ichthyosis nigra. It gets started from less than 3 months. It is X-linked recessive. Ichthyosis vulgaris was autosomal dominant. Ichthyosis nigra is X-linked recessive. Here the defect is steroid sulfatase, enzymatic defect, and scales are brown-black in color. It is also associated with corneal opacities and cryptorchidism. Next is laminar ichthyosis. It is severe disorder. It is seen at the time of birth. It is autosomal recessive. Defect is with epidermal transglutaminase 1 enzyme. A translucent parchment-like membrane covers the neonate, which is called collodion membrane, as seen here. Scales are dark, plate-like adherent, as seen here. Ectropion present in the eyes. Lip is labium, which is outward movement of the lip. Next topic is xeroderma pigmentosum. It is a disorder of DNA repair, which is defect in nucleotide excision repair. It is autosomal recessive. Cutaneous lesions, photophobia presence, freckles which are hyperpigmented, dry skin, and skin malignancies can be seen. Photophobia, freckles, skin cancer, and dry skin can be seen. Now let's see one previous year question. Which of the following are not cutaneous manifestations of dermatomyositis? Now let's see what is dermatomyositis. It is an autoimmune disorder which is predominantly affecting the skin and skeletal muscle. The following are various manifestations of dermatomyositis. Gottron's papules, which are violaceous erythematous papules overlying the dorsal interphalangeal or metacarpophalangeal elbow or knee joints as shown in the image below. Heliotrope rash. It is erythematous discoloration of the eyelid with periorbital edema. Gottron's sign: symmetric, non-scaling, violaceous erythematous macules or plaques, often atrophic in the same distribution as Gottron's papules. Shoal sign or V sign: it is fixed macular erythema across the shoulders and outer arms, which is shoal distribution. Periangual telangiectasias, which are dilated capillaries of the nail folds. Mechanics hands: roughening and cracking of the skin of the tips and sides of the finger, resulting in irregular, dirty appearing lines that resemble those of mechanic or manual laborer. These all signs, shoal sign, heliotrope sign, and mechanic hands, are present in dermatomyositis. But what is not present is Gorlin sign. Now let us see what is Gorlin sign. It is the ability of the patient of Ehlers-Danlos syndrome to touch the tip of the nose with the tip of the tongue, like this. Thank you.